Hey everyone, I'm Anastasia Turchetta, editor of Modern Hygienist, starting up a new series, Your MD and Me, and I am so pleased and honored to kick off this series with my friend and colleague, Stephanie Lodding, who is a dental hygienist, and guess what? She is also president of AAOSH, so I'm going to go ahead and just introduce her right now. Stephanie, welcome.
Thank you so much. I'm really excited and honored to be talking and speaking with you today and your audience about oral systemics and about AAOSH, the American Academy for Oral Systemic Health, and what it can do for hygienists, because hygienists are on the leading and the forefront of dentistry right now. We are riding a new wave in dentistry that is absolutely amazing, and it's going to change the lives of hygienists. It's going to change the lives of patients, and it's going to change the way we practice dentistry, and I am so excited to be leading that crusade and getting hygienists involved with us.
This is your first, a dental hygienist has not held a president position for AAOSH before, correct?
No, so AAOSH was formed in 2010, and I have been the only hygienist on the board and was really honored and very humbled to be voted as the president, very first hygienist, and super excited to be able to change the face of the organization and really bring hygienists in and let them know how important we are to changing the face of dentistry and really bringing medicine in as a part of a regular part in the routine visits and really honestly saving lives by doing that.
You said a key thing. You said really changing the lives and bringing medicine into it. Now, we've both been doing clinical hygiene for years, and we've been in different realms of the profession. Saying medicine to me obviously is going through our patient's health history, understanding the side effects of medication, but AAOSH brings a different spin to it, and we've heard the word the oral systemic health. So I've got to ask you, for AAOSH, what is the role or your goal for the dental hygienist to become more accountable in medicine and working with MDs and our patients?
Yes, so in the past, when we've had a patient and we've had a question about the medical history, whether they should be on pre-meds or not being on pre-meds, we've all made those calls and tried to get medical releases. And this brings on a whole new equation. What I'm finding over the last 10 years of really digging into oral systemics is that I'm really leading the way. Physicians really do not understand how chronic inflammation, and the statistics, actually Dr. Roizen, who spoke for us at the Cleveland Clinic in 2012 at our meeting, he made a really strong statement by saying 70 to 80% of chronic inflammation comes from oral disease. And so if we can get inflammation down in the body, we can connect with 80% of chronic diseases, and that is such a huge, huge impact that hygienists have on the health of our patients. And whether it's diagnosing and looking at sleep apnea as a component of that, or whether it's periodontal disease, or some of the other things like nutrition. We really, as hygienists, we see the patients far more than dentists do, and we take care of the patients in the time that we see them. We see them 2, 3, 4 times a year, and so our ability to be able to connect with that patient on a different level and look at them from the medical side and then connect them with their physician is a really key to success.
You made a great point with that. So I've always been a believer that, even like, let's just take, for example, those who live with type 1 and type 2 diabetes. I'm always asking my patient, do you know what your last HB1AC reading was? Or now they call it the ACs. And a lot of my patients they'll look at me and they're like, well, what does that matter? So I applaud you. This is great to bring this into the forefront. Now my next question is then, obviously AAOSH is an association. What's the membership for dental hygienists?
Yes, I'm really excited. I have been our crusader on our board. It's a board of all dentists, and so they can afford more, and so they look at the membership as being an expense that they can charge $200, $300, $400. And for hygienists, I've always had a sticking point that we need to make it very reasonable, and so it's $99 to sign up as a member of AAOSH. And with that, what you get is you get a monthly webinar series. And we have different companies that will come in and teach you about their products, whether it's xylitol or implementing sleep apnea materials, or we have deep science involved. So you can watch an hour of deep science linking heart disease with the bacteria in the mouth and bacterial testing and things like that. So it will really engage the hygienist in a really fun way, but it'll get them into the deeper science and help them to start to make a change in the practice and how we're treating patients every day. It's really been an awesome series.
So your membership, okay, so it's $99 per membership for a dental hygienist. With the webinars, I'm assuming once they get the facts, this would help them, even before communication starts, to understand which products may best benefit their patients and why. Because when you're getting to the science, you're also getting into the ingredients and understanding how that affects the body, how that affects whatever ailment they are living with, or in that respect. So I mean, that's awesome. So you've got the webinars and the membership. Where can people sign up at if they're interested?
Yes, you can go to AAOSH.org, and our website has everything on there from our next meeting, which will be hosted in September in Dallas next year. So you'll be able to read on the speakers that we are having, because we'll be having those on the website. And you'll be able to find out about what's involved in that meeting. And it's really, really exciting with that next meeting that we have coming up, because what it does is it brings you into the deep science, and it helps to teach hygienists who are kind of out of that realm a better understanding as to what we're talking about when we're really talking about oral systemics, as you mentioned, the A1C, what that number really is and how it affects and impacts the body. And when those numbers, well, you know as well as I do, when you're looking at diabetics, 1 in every 3 is pre-diabetic, and the statistics are staggering in those patients that don't know it. And by the year 2020, they're talking about 1 in every 2 patients. And so it's very, very important for us as hygienists to now take that next step. Our dentists that we're working for are out learning about how to do cosmetics, and they're learning about how to do restorations and restorative on the teeth. But what hygienists can do is now take the lead and actually have a practice of their own within the practice, and really be recognized for the healthcare provider that we really are, and change the way that they're practicing dentistry.
Well, it is taking the lead. I mean, there's always a role, and there's always a role to expand within our profession and the entire team. So I'm in full alignment with you, because doctors don't have time, so they do rely on that for us. And there's so much more in health histories that we're not even addressing. So that's amazing that we have the opportunity to do that. Now, you mentioned that your meeting is in 2015. So I do have to ask you, I mean, dental hygienists are investing in either memberships on their own sometimes, or they may attend events also on their own. And it could be really tight on the budget. So what may inspire, or why would a dental hygienist who's working in clinical invest in going to this scientific session in 2015? Like, what can they get out of it to say, wow, you know what, I really like to know more about the medicine, but I need something to basically warrant me going forward and making this investment?
Well, what I'm suggesting is that hygienists now have the opportunity to change the way we've been practicing dentistry and really be recognized and valued, and really making a really nice salary increase by learning this education. And at our meeting, we keep our membership the fee for the meeting, for hygienists only, we keep it at our cost only, so there's not a large markup, so it's very affordable to be able to join our meeting.
That's a great incentive. And the other one too, because I'm thinking, okay, so let's give our fellow hygienists and colleagues something that they can look into right now, working, if this is the first time they've heard of AAOSH, or we've all heard about oral systemic health, but there was a book from individuals who were it's an amazing book to help us own what's going on in our own system dealing with the heart. Can you tell us a little bit about that and direct our audiences to saying, you know what, you may want to look into this, and just kind of get a feel as to how we can start to educate our patients chairside now?
Yes, so there's a book out called The Heart Attack Gene, and it's written by Dr. Brad Bale and Amy Doneen, and they have been speakers at our conferences every year, and they also are on the webinar series. They give you the latest updates, and they wrote a book on the heart attack gene, and it really brings into focus what hygienists can do to talk to their patients, whether it's looking at literally a crease in the ear, which can increase their chance and risk of having a heart attack. They give you all of those little tools that we never knew about, and really help you to connect with the physician and give you verbiage that you can help to connect with the physician. So it's
That
really,
is
really
awesome. I love this kind of stuff. Okay, so it's the heart attack gene, and we're going to include that link within, within this, and you'll see it with it also, for more information. So if you're interested in that and finding out more, you've got it. Now, this is the series again. It's your MD and me, and I got to leave a teaser. So we're going to do this as a series every other week. So Stephanie, what are you going to reveal to us next time?
So I think the most important thing that we can do is talk about implementation, giving you little nuggets of information that you can take back and talk to your team about the next day.
So looking forward. First of all, Stephanie, congratulations on becoming president of AAOSH. Looking forward to delivering this series, Your MD and Me, the dental hygienist role with the medical profession. This really could help, hygienists take more ownership and become accountability leaders within the practice. And you know what, really, all in all, it just boils down to us now investing in our patients' health to save lives. So awesome. Thank you for joining me, and we look forward to discussing more in a future session.
Thank you so much. I look forward to it.